Hi, I'm Amy from Mare Wellness and Myofascial Release. In today's video, we are going to do myofascial self-care for the legs. We're going to work on the thighs and the calves. And in this video, you will need your therapy balls, which are dense but still have some squishiness to them. If you have a lot of tenderness, or this is one of your first times trying this, then you may want a bigger, squishier ball. Remembering the principles, if you haven't watched the introductory video on the basic principles, you should really watch that first before you jump into some of these videos. So, because you never want a lot of pain. You want a therapeutic sense of tenderness, a hurts kind of good feeling, but you never want pain that makes you hold your breath or tense up against it. You always want to be able to relax your whole body when you're doing self-care releases. So if this starts to make you hold your breath or start to wince or flinch, then switch to this. Okay. You will also need a yoga block. If you don't have a yoga block, you can use a book or something that's around the same size. So we're going to start in a seated position, preferably on the ground. If you have trouble getting all the way on the ground, there's some adaptations you can do, and I can talk about those a little bit as we go through. The first thing you may want to adapt is sitting on either a block or a pillow to lift you up. That makes it easier to get your low back curve into the right position and get some of the angles of the hip that we're going to need to do these releases. So the first thing I want to point out, we're going to start in the right thigh. And in your thigh, from your hip joint down to your knee, you have what's called your IT band, and that kind of runs right about where my stripe is. The IT band is a thick, dense line of fascia that helps to create stability in this area. We don't necessarily want to work right on that IT band. The fascia that we're going to focus on is going to be the fascia that connects the hamstring over to the IT band, and there's a lot of denser fascia here. And when I'm working on clients, I'm generally working on the fascia on either the hamstring side or the glute side of the IT band. So right now we're going to focus on the hamstring side. So getting into this position, you're going to take your therapy ball and get up as close to as you can to the actual hip joint. You don't need to be 100% accurate in your placement of the ball. Just feel that space and try to feel a bony area there, and then place the ball below or closer to the knee, but on the hamstring side or the back of the thigh side of your IT band. Okay, the next step in the process here is to lean into that, to find a point that feels a little bit tender. And remember, you always want a mild to moderate sense of tension or tenderness. That's how you know you have a spot that needs to be released. So once you find that, then you can lean into it a little bit until you feel that mild to moderate sensation. And if you need to lean a little bit more, and because remember, another principle is we always want to maintain our best low back curve, our best posture, then taking your block, placing that on your leg, and then leaning into it until you feel that sensation that you're looking for. And then run through, soften your body, your jaw, your neck, your shoulders, chest, back, hips, thighs, calves, feet, everything that you can in order to really focus in on that spot. When you're feeling that sensation, soften and breathe with your belly. Remember that diaphragmatic breathing helps to stimulate the vagus nerve and actually soften the body. Generally, you need to hold your releases, your self-releases, for 2, 3, 4, sometimes even longer, in order to get that sensation of release. And what does that sensation of release feel like? It generally feels like oh, it doesn't feel so tender anymore. It feels like the tenderness is just kind of dissipated away. The first few times you do this, or if you have a lot of chronic issues in this area, it may not release the first time you do it, no matter how long you wait. So if that's the case, then work away from that area and then come back to that area later. Harder is not better. The other thing you don't want to do is roll. Resist the roll. The pressure, the press and hold is what does the release. When I'm working on someone, I am not rubbing the tissues, I am pressing in and holding. So the rubbing is more like a massage to the muscles or to the tissues. Okay, I'm feeling like the space is starting to just dissipate a little bit. I'm not noticing as much tenderness. So the next step in the process is simply move down that line. So I'm just going to move the ball about 1/2 inch, 1 inch, and then I'm going to lean back into it. And this particular spot doesn't feel super tender, so I'm going to roll down a little bit farther. That doesn't feel too tender on me either. I'm going to go a little bit farther. Now I found one. So, and my right hip will tend to act up once in a while just from an old injury. So when I am doing my own self-care, then I do a lot of work in this particular area myself. But another principle is don't just work the space where you are feeling the pain. Work on the opposite side, and then work on the opposite side of that area, which would be the inner thigh, right inner thigh, and we will go there shortly. Okay, so you would want to breathe, hold, relax. For the video, the purpose of the video, I'm not going to hold all these releases to a therapeutic dose. What you can do is just pause the video and hold until you feel your release, or you've waited at least 3-ish minutes. If you're not feeling any changes within 3-ish minutes, then you may just want to continue moving on down the line. So again, I'm going to move the ball another inch, and it's getting more tender as I get closer to the knee. Even though my experience of pain is up around the hip, you can have tenderness down this line. In another video, I talk about how, yes, our fascia is one big web of fascia throughout our whole body. It's all interconnected, but there are some thicker lines of fascia in the body, and those thicker lines support us functionally from overbending in certain directions, or they help the muscles move in a more coordinated fashion. So it's pretty common in my practice that I see people who have all one-sided issues where that side line of fascia has tight spots in it, but the experience of pain can always be away from exactly where that tension is. Okay, that's letting go for me, so I'm going to move on down. Okay. It's not so bad. Now, if you're working, just another adaptation, and you can't get that kind of range of motion in your hip, you can put your yoga block underneath. I feel that a little bit more. Wherever you can create the leverage you need, but again, remembering you don't want it to be too much. You want to find that mild to moderate, and then lean into it, soften and breathe. And as long as you are on soft tissue, that's what we're looking for. You don't want to be on bone. You can nudge up against bone, but do not be on it. You do not want the direct pressure on the bone. Okay, feeling quite a bit right here. So we'll pause here for just a moment. Soften and breathe. Again, this treatment self-care pairs really well with a good Netflix series or Amazon Prime or whatever you use. I also like books on tape, podcasts. A good YouTube series is okay too. The nightly news, whatever your preference is. Or you can just breathe and meditate. What I don't want you to do is completely distract yourself from what you're doing. You need to be able to, whatever you're using to promote your ability to sit and work on yourself for a long time, you still need to be feeling what's going on in your body. Okay, that's starting to let up for me, so I'm going to go down just a little bit farther until I'm really close to the bony prominences around the knee. Okay, so I am leaning into this, but I'm still keeping my low back curve. I'm not slouching into it. And keeping your posture as good or as correct as possible in these is always teaching your body to be in good posture and promoting strength in the muscles that maintain good posture. So think of that as part of your exercise or your self-care routine as well. Okay, big breath there. That's a tender spot, and I'm having to let go of tension in my hips. Okay. All right. So after doing that, we're going to just move that area, get things gliding a little bit, pump out some of the waste that might have been stuck in there and create a little blood flow. Okay. Next place we're going to go is down through the calf. And if you touch along the front of your calf, you'll feel that bone. And then if you bring your fingers off to the side, you'll feel that there's you start to feel the soft tissue. And generally, where all the muscles connect to that bone, you're going to feel a lot of thick fascia there. And if you run your thumb along through there, you might feel some tender spots. So that's where we're going to go next. So we're going to start up. If you feel that bone, and then feel the other bony areas of the lower leg bones, we're going to go in the soft spot right there. And again, as long as you are on soft tissue and just roll enough until you find a tender spot. The rolling is only to explore, and then lean into those tender areas, gently but firmly. Okay, that spot's not too bad for me. I'm going to go down a little bit lower. And again, your position doesn't have to look exactly like mine. If it's easier for you to sit differently, that is okay. However, you can get into that spot. Okay, this is a pretty tender spot for me. Working in the calves can really help with foot pain and knee pain, shin splints. If there is any kind of a lower body issue, work in the calves. There's so much of the lines of fascia in the body move down into the calves and then into the feet, because remembering that our fascia is a proprioceptive mechanism, that means it helps us know where our body is in space, and we get a lot of that information from our feet, from our lower body. Okay, I could probably hold this one for quite a while. I'm going to move it down a little bit lower. Oh, right there. So again, finding your position and pausing the video if you need more time. The video is about learning the process, and you don't need the video to continue on your own, but I would definitely watch it as many times as you need to remember the principles. The principles are key. Okay, I'm going to go down a little bit lower. Again, rolling to explore. There's one. Now, I've answered these questions in a lot of the videos, but these are very common questions. A common one is, if I work out the tension that I'm feeling here, will I ever need to do this again, or is it gone? My answer is always, unless you dramatically change the life that you live, our lifestyle is continually putting tension into our bodies because we don't use our bodies the way that they were designed to be used. We do a lot of sitting, and we really weren't designed to sit, where our bodies are designed to stand, walk, and squat, and lay down. So because we don't do a lot of squatting, we don't get a lot of stretching, especially in our calves. So yes, unless you change your lifestyle, you will have a continual buildup of tension in your body. And that tension is going to increase and stay in your body if you have a lot of stress, if you have had old injuries or surgeries. That will definitely build up the tension in your fascial system. But continually coming back and doing myofascial self-care as part of your regular exercise and movement program can make a huge difference. And if you keep at it, you will eventually find that you need to do less and less. Okay. All right, so now we've got the outside of the calf. I'm just gonna do a little pumping and movement to move that around and get some blood flow going in that space. Next we're going to do is the inside. So let's start with the calf and work our way back up. So you have a couple options when you're working on your calf. What I typically like to do is place the ball on the calf, and you can either use your hand to roll it to find a tender spot, or you can use the block to roll the ball to find the spot. And then once you find the spot, leaning into it. And I'm going to grab it just a second blocked so I don't have to lean over quite so far. Okay. Some tender spots in there. These are quite a bit sharper in their tenderness. So I want to make sure I'm not leaning in too hard, because again, keeping it mild to moderate. Let me cover too. I didn't cover, find that bone and then just move toward the inside of your calf until you feel those softer spots, and just kind of poke around until you feel some tenderness and know that's where you're going to need that ball. I don't need to push very hard there. Okay, find your posture, soften your body. Okay, then I'm going to roll up. Okay, another little spot here. And again, you might find that you have a lot and it's going to take you some time. Just be patient. If you don't have time to do all of them, just go for some of the more tender spots. If they're too tender, go for some of the less tender spots, and then go back to those ones that are areas that are more tender. Okay, I'm going to move all the way up as close as I can get to the bony area without actually being on it. Okay, That's pretty tender right there. Another option for the inside of the calf and thigh is to lay down, and I will cover that when we're done going up here. Okay, so the next place I want to go, let's just pump that out just a little bit. You can do a little bit of gentle rubbing as well. I probably could have spent some more time right there. So we're going to go on the inside. So feeling your quadricep muscle here, and then feeling that bony part of the knee, and then just kind of push in through here and just see where you might find a tender spot, if any. So we're going to go right there. And I'm going to start in this position and just see how this works for me. Okay. Okay, I'm going to hold right here. So again, anywhere that feels tender, mild to moderate tenderness, it shouldn't feel what I call nervy. If it feels super sharp and like it zings and moves other places in your body, then you want to stay away from there. You want to make sure you're not on a nerve. Okay. Soften, find your posture, and breathe. And again, working all the way up. Okay, right here. Okay, and again, taking the time you need. Okay, let's cover your other options. So you can lay down to do some of these releases. The only thing you have to be careful about when you're laying down is you've got more weight and maybe not quite as much control. But if you don't have a lot of tenderness, then the weight of your legs would be okay. So you have to find that mild to moderate sense of tension and pressure. Okay, so you can move all the way down, laying down, and then if you're going to do the inside, what you can do is place the block between your legs and then find your position here and let the weight of the leg put the pressure down into the ball, into your leg. But as long as you can soften, and this isn't too much pressure, and you can really modulate it as needed for you, this is absolutely fine too. Now, if you were going to do, you could also have the option, we won't do the other leg in this video, but you should always do the opposite side as well. So you can place your block on the bottom. This would then be less pressure on the inner thigh with this particular method. And then you can do this if you're super talented. You can have one on either side, but don't recommend that. Okay, so there's a spot there. Okay, so as long as you can soften your body and maintain your position, you can get creative with how you achieve the input. Okay, so that is how you do a lot of the lower body releases. In a separate video, I will cover more on the quadricep and the hamstring. But for now, this going on either side of the IT band can help solve a lot of problems. Going down through the calf on either side can help also solve a lot of problems in the feet and the knees. Okay, I hope that was helpful. Make sure that after you do a deep stretch like that, you ease into your movement or exercise nice and slowly. And and follow all this with a few squats or a little walking. Can be very helpful to start to mobilize those tissues. Another great option is a legs up the wall pose. That's another video to really help to mobilize those fluids. All right, thank you and have a great day.